Every day in my practice, I have patients coming in and asking me for liposuction, and what they're really concerned about is cellulite. And I think the first thing I have to say to them is that, liposuction is no treatment for cellulite. The treatments for cellulite have to be multifactorial, right? I think they start with diet and with exercise. That probably is the best thing we can do to sort of help the look of the skin. And then it's to figure out what's causing the cellulite and how to treat it. So for the dimpling, a lot of times in the buttocks and sometimes the lateral thigh, we have a new treatment called Cellfina. Cellfina is a procedure, but it's a small procedure done under local that will actually go in and sort of cut those little bands that have been created that create the denting. It's almost like a tufted sofa with these little strings that are tufting in the sofa. If we can just release that, this sort of dent will go away and the skin will look smoother. The other component is looseness. It's really hard to treat the looseness of the skin and improve cellulite. The most common surgical way is through some type of thigh lift, because then you lift and tighten the skin and you see improvement. But for those patients who maybe don't have that much cellulite or they don't have that much looseness that will benefit, then we have a non-surgical treatment called ThermiSmooth that uses basically radio frequency on top of the skin, almost like an ultrasound probe, and heating, and it sort of heats the skin, and through a very sort of, I think, advanced procedure, actually produce some very, very nice smoothing and improvement in texture and tightness of the skin without doing surgery. And so I think ThermiSmooth has been a great adjunct. So in my practice, when I see somebody with cellulite, it's not uncommon that we're gonna add diet, exercise, some Cellfina for the dimples, and some skin tightening through ThermiSmooth as sort of our treatment plan for them. And only in the more severe cases would we consider surgery.